our communities, as we continue to ensure that we are focusing our efforts on the most impactful areas of priority that are creating barriers for women and girls and their families in northeastern Pennsylvania. We want to make sure that we're putting our investments in areas that are going to continue to make real change. And we're hosting these webinars to understand the barriers and opportunities that exist. So we have an excellent panel tonight, a plan for this evening, and this panel is going to be moderated by Lisa Durkin, President and CEO for United Neighborhood Centers and also a WIP supporter. And she moderated the first panel on childcare and early childhood education and did a fantastic job. So we're so glad that she's back with us tonight. She's going to introduce our panel and she's going to guide us through this critical discussion. But just a little bit of an overview on what we've learned so far, specifically on this issue. We know this topic is very timely for many reasons. President Biden has recently released the American Families Plan, which includes $1 trillion in new spending and $800 billion in tax credits. Much of what is aimed at expanding access to education and childcare. And this topic of childcare or early childhood education, which we heard specifically related to so much more in the first panel, is that we need to make sure that that runs so concurrent with the issue of childcare, is that this runs considerably through this proposed package, including financing for universal pre-K, federal paid leave, and efforts to make childcare more affordable overall, free community college, and aid for students that historically serve non-white communities, and so many other areas. So we know that that is such a timely topic right now. And at the same time, we're learning through our first panel discussion several weeks ago that it included professionals serving areas, including childcare from the United Way of Lackawanna and Wayne counties, United Neighborhood Centers, SLHDA and Head Start Outreach, and Lackawanna County Office of Family Services, that there were several things that really stood out in terms of barriers to childcare and early childhood education in our community. And that's that the connectivity of employment, childcare, and housing can often limit folks' choices and become a barrier for accepting job advancements and new opportunities, and in limiting economic mobility. And that choices due to COVID have become more limited in securing quality child care and has often forced smaller child care centers to close, limiting options for parents further. We learned that child care deserts exist, and they exist more so in rural components of our counties. That education and resource support is needed for parents when making child care decisions that maximize the monetary resources available. That the speed of being able to secure childcare is also important for those being able to re-enter the workforce, that transportation is a true barrier for childcare and is often the deciding factor in where to enroll your children, and that the lack of reliability in off-hour childcare can truly limit economic and employment opportunities for individuals that want to take shifts that are off hours. So those are some of the things that we know are barriers. I think we're going to hear, in addition, some many more timely themes that we should be paying attention to, and hopefully some solutions that we can continue to explore investing in. And we're extremely grateful to our panelists tonight and their time taking to visit with us and share knowledge with us on these issues. And I'm going to turn it over to Lisa Durkin now, who are going to help us take a deep dive into this. And just remember, the last 10 minutes of tonight's panel is reserved for Q&A. So if you have anything you specifically want to discuss that comes up, feel free to put it into the chat or the message function, and then they'll get addressed later in the discussion, unless people feel like addressing them while we go through it. So again, thank you, and looking forward to our conversation.
Thanks, Laura. And I'd like to extend my appreciation to the Scranton Area Foundation and Women in Philanthropy for initiating these conversations. As I've said before, this is really the first time our community has been talking about childcare in this bigger, more strategic way, the way we've tackled other large issues. So we're very grateful for this opportunity. I'd like to introduce our panel and invite you all to tell us a bit about yourselves and the organizations that you represent, starting with Jen DeBell. And Jen is the Executive Director of the Pennsylvania Association for the Education of Young Children.
Hi, everybody. Thanks so much for having me today. I'm happy to be here. So our organization, the Pennsylvania Association for the Education of Young Children, otherwise known as PennAEYC, is a statewide nonprofit organization. We're a membership organization of about 2,500 early childhood professionals across the Commonwealth. That includes your childcare teacher, director, pre-K teachers and directors, as well as professors of early ed and students as well, and more. And we are the Pennsylvania affiliate of the National AEYC. So we're actually part of a bigger group across the country of about 52 affiliates and 60,000 early childhood professionals. Our mission is to be an effective voice for high quality early childhood care and education. And we do that through policy development, advocacy, as well as providing professional development and other supports for the professionals in the field. And I just want to point out, we're a very proud partner in 2 statewide advocacy campaigns. The first is Pre-K for PA, which advocates to improve access to high quality pre-K across the Commonwealth. And the second is called Start Strong Pennsylvania, which launched in January of 2019. And this nonpartisan advocacy campaign focuses in on our topic of today, which is ensuring high quality, affordable childcare is available to all Pennsylvania families. So again, thanks for having me. Happy to be here.
Thanks, Jen. And Bill Grant, the former owner and CEO of Hildebrandt Learning Centers.
Hi, I'm retired, CEO of Hildebrandt Learning Centers. I operated 45 employer-related childcare centers, Pennsylvania, West Virginia, New Jersey. I think 35 of our centers were accredited by NEPA. So I have a lot of experience, and I think I've established about 120 childcare centers in my 35 years. Right now, what I'm doing is I'm a childcare consultant, helping mostly small mom and pop type organizations establish childcare centers throughout Pennsylvania. So I'm keeping busy.
Sounds like it. Welcome. And Andrea Heberlein. Andrea is the Executive Director of the Pennsylvania Early Learning Investment Commission.
Yes, thank you very much. I'm pleased to be here. The Early Learning Investment Commission is a commission of about 50 senior level business leaders across the Commonwealth who are appointed by the governor. You know, we are nonpartisan, but we, answer to the governor, and he has charged our commissioners with advancing public-private investments in early learning. And so it's kind of interesting. And I think for this group, it might be kind of informative to kind of think about how the commission formed. So in 2007, the Office of Child Development and Early Learning was created. And so this was a bridge between the Department of Education and the department at the time was Department of Welfare, which is now Department of Human Services. But what this did is this really bridged the gap between education and what was probably called daycare at the time, but childcare. And that's where we really started in the state of Pennsylvania to talk about quality initiatives like Keystone Stars, state-funded high-quality pre-K, like Pennsylvania Pre-K Counts. And the deputy secretary, the very first deputy secretary of OCDEL, in her wisdom, I think, thought a lot about the sustainability of these programs that were so important to children and families. And so she was instrumental in having the Pennsylvania Early Learning Investment Commission begin thinking to herself, I'm kind of assuming this is what she's thinking, but when we have teachers and childcare providers and parents speak to our legislators, they listen. But when you have CEOs and CFOs talk about the importance of quality childcare, legislators listen a little differently. And so she really felt like having that leverage would be instrumental to the sustainability of a lot of the work that was happening. And I'd like to think that she was right, because our commissioners understand deeply how important investing in childcare is to kind of the current workforce, but also the future workforce in Pennsylvania's economy.
I'd like to think so as well. That's excellent. Welcome. And Dr. Marnie Aylesworth, the Executive Director of the Pennsylvania Key.
Yeah, hi, thank you so much. It's good to be here. I love seeing my colleagues on the screen. I am with the Pennsylvania Key. I'm the Executive Director there, and the Pennsylvania Key is a business partner of the Office of Child Development and Early Learning. We were created when Octal was created as a business partner, really to do some of the boots on the ground work. The office is responsible for policy. The PAEYC is often responsible for implementation of that policy. We view our role as a supporter of the early childhood educator in everything that means, their professional development, their health and wellness, their mental health, and anything else that we can do to support the workforce. We also help to monitor many of the state programs like pre-K counts and the infant toddler contracted slots. We also, on a side, unrelated to Octal, we offer consultation services to businesses who are investigating ways to support their staff, their employees in some form or fashion around childcare, whatever that looks like. Maybe it's simply surveying their employees to find out what it is they need, or will it support them in looking at different financial opportunities to support their staff. And so we have been doing this for about as long as Octal has been around, and we're very grateful to be in this work. I personally have been in the field as a teacher and as a center director for the last, I've been in this field 30 years now. So I'm very grateful to be a part of this community.
Excellent. Laura, I don't know who's responsible for getting all of the right people in these seats for the discussion, but job well done. I think the introductions here have just whet our appetite for this discussion.
Our team was fortunate, Vivian and Maggie making such wonderful connections. We're extremely grateful with who we have tonight. Thanks, Lisa.
Yes, excellent. Let's jump right in. President Biden's proposal touches on topics that you're all very familiar with. In your professional opinions, I mean, what benefits are in this plan that are really going to support the families that we work with every day? And I'd like to put that out there to all of you, and maybe start with Jen.
Sure. So when I look at the plan, there's two things that really stick out to me as far as helping families. Probably one of the more obvious is that the American Families Plan does talk about affordability of childcare. Most people know childcare is unfortunately equivalent to your rent or your mortgage. And that expense often comes for parents at the time in their careers that's pretty early, and they're earning less than they would later on in life. So President Biden's plan would ensure that the lowest income families would have childcare costs fully paid for, and others would only have to pay no more than 7% of their income. Right now, our subsidized childcare program for most families has a limit of 11%. So that would be a pretty big improvement. The other thing that sticks out to me as an advocate that might be a little less of a traditional answer is it has a commitment around supporting our workforce. And what people don't realize is when we talk about teacher wages, Pennsylvania's childcare teachers make on average a $10.69 wage an hour, 50% receive public benefits. These are teachers we rely upon to be with our children in the classroom. And those connections they're making with children are what make high quality programs. So it's essential that we have highly qualified teachers that are compensated appropriately and we retain them in the classroom. Right now, because of their wages and compensation packages, we see a lot of teachers leaving the sector for other jobs, whether it's the K-12 system or unfortunately going to think, like Sheetz, Walmart, convenience stores that pay better than the early childhood field. So that teacher turnover has really negative impacts on our kids. So for me, seeing the focus on teachers will also help our families in that it'll help provide better and more stable childcare to children.
Yep, good point. I've heard it. I've heard it from staff. I can take a less demanding job and make the same money and not feel these pressures. It's a very real concern. Marnie, can I ask the same question to you?
Yeah, so I think about the workforce too, and it does trickle to the families and to the children because of the salary discrepancy for our staff. We know money doesn't solve all problems, but it certainly helps keep you alive. And when you're struggling to just keep paying the bills day to day and keep food on the table, it makes it very difficult to be your best self in the classroom. And it really wears down on their mental health. And so the mental health and the well-being of our workforce in early childhood is at an all-time critical place. And I honestly believe that these investments, not only in salary, but also in the education of offering community college for free, would help to raise up our staff, who we are trying to professionalize and move up in the education world, but we can't do that and expect them to continue to get these wages. And so it'll kind of move them up together. And that in and of itself will improve their mental health and well-being, which I believe presents the most best person for their children in the classroom.
You put it in perspective for us. We're not talking about people looking to get rich, just a need to support their own families, further enabling them to help support others. Bill, would you echo and add to some of this?
Yeah, I agree with Marnie and Jen. Help for our teachers is critical, and teacher education is really, I think, important for the quality. We talk about quality, and if you don't have quality teachers, you could have the greatest looking center, the best looking equipment, the nicest playgrounds and so forth. But if you don't have quality people to deliver that care, our children are going to really suffer. I'm a trustee at Wilkes University, and we have an education department, and we only have, when I talk to our dean, we have a handful of people who've declared major for early childhood. Why? They look at the wages and say, I'm not going to pay $100,000 or $120,000 for an education and come out and make $10 an hour. It just doesn't make sense. So I think we have for me, that's critical part of of Biden's plan. I have a couple of other points that if I could real quick. I know they talk about the 7% of family income, and then I assume that the government will make up the difference. One of the things that I'm concerned with, I'm not sure if the government really understands the true cost of childcare, and that's important also. They need to understand that it's wages and so forth. They just can't pick a number and say, well, we're going to reimburse you $7,500 or whatever. We really got to get to that true cost. I'm also concerned a little bit about the universal pre-K and how it's going to be delivered. Is it going to be delivered in our public schools, or is it still going to be delivered in our childcare centers? And my concern is if it gets moved over into the school districts, what happens to the infant and toddler care, which is also critical in childcare. They talk about 4 and 5-year-olds, but everybody forgets about that 1 to 3-year-old group. So I'm concerned a little bit about that. And then if it is being moved to the school districts, is that an 8 to 2? And then what do we do with the before and after situations? Because we're talking about working families here that go to work at 8 o'clock and don't come home until 4:30. So there's that coverage that they have to make sure that they have. So those are just some of the things that I saw in the bill that I have. Some things are great, but I think that some things need to be worked on and defined a little bit better before we move on.
That I hear experience talking there. I know what that looks like. We recently replaced some lighting in a gymnasium in a childcare center. And what do you do, right? You don't want to pass that cost on to the families that are already struggling, and these are difficult times. But it's a challenge. There are costs that aren't fully represented sometimes in childcare centers. Andrea, can you add to this?
Sure. And, I'm going to try through this, webinar to really take the business perspective. And the thing that really resonated with me as I'm reading through the American Families Plan is that there is such an opportunity to capitalize on return on investment. And so this is something that really speaks loudly to our business leaders. So when we're talking about, investing in quality childcare, we're really fortunate because we have the longitudinal studies that show, anywhere from $1 invested, you can, gain $7. I've even seen up to $27 in cost savings related to, savings in remedial education, substance abuse, the costs associated with teenage pregnancies and incarcerations. And this really resonates. And when I read the American Family Plan, it's like they really get it, and they're really emphasizing quality. And if we can make quality childcare affordable for our most vulnerable children, we're going to reap the benefits, you know, down the road. We're going to have more children enter kindergarten ready to be successful. Those, you know, benefits are going to continue on, and they're going to be becoming, you know, members, productive members of our workforce. And I think that, you know, there's a lot of potential. I totally agree with Bill. I think things are complicated and complex, but I think this is a really bold statement that by investing in children and families, it's the right thing to do for you know, our country and our economy.
Yeah, you called it an investment and then spelled out exactly why it is labeled as such, an investment. Good point. So you all are sitting in an interesting vantage point. From your perspective, what are the main barriers families face when seeking and securing affordable childcare? It's another question I would like to hear from everybody on. Marnie, would you mind starting?
Oh, sure. I think I'm going to put cost at the top of the list. I think you kind of highlighted that. We've all highlighted that in the beginning question. That and the other thing is, I don't think that families are always aware of the subsidies that are available. There are wait lists often on the subsidy list too. So it comes down to cost. And the other thing I would say is hours, evenings and weekends. We have a great proportion of our staff of our employee workforce in Pennsylvania working evenings and weekends and shift work. And we really haven't cracked that nut yet and figured out how to support those families. So I would put those at the top of the list, but I'm sure my colleagues here have some other suggestions.
Perhaps. I think you're probably right. I would argue that is probably the number one factor, the first factor. And that's a good point. You know, cost probably scares many families away and they don't get to the second step, you know, in seeking subsidies. Andrea.
You know, I'm going to, again, look at our business community. And, you know, I love that Bill is joining us today because he has done phenomenal work helping businesses who have recognized how important it is to support their working families through childcare. But it's really a slim margin of businesses that really traditionally have recognized how important it is to help their working families, you know, access affordable quality childcare. And I think we'll get into this in a little bit. There's a lot of different, you know, opportunities that businesses can consider beyond just an on-site childcare center, which is like kind of the gold star. But I think it is a barrier for a lot of working families when, you know, their companies don't quite understand, you know, the challenges that they have and the role that businesses can play. And I will say, you know, with the pandemic, you know, we think about sometimes silver linings, but we have seen, you know, articles about, you know, businesses recognizing what a critical need or critical piece of the workforce infrastructure that childcare is when it became very apparent that they weren't able to do their business because their working families didn't have access to childcare. So we're seeing, you know, articles in the Wall Street Journal and, you know, New York Times, and it's really elevated the level of the conversation. And I think, again, this is kind of an opportunity to spur more businesses into action. But so I think, you know, in the past, and it has been kind of a barrier for working families, but I think we have a good opportunity to change that narrative.
Good point. Bill, you've seen it firsthand, right?
Yeah.
What are the barriers?
Well, number one, I agree with everyone. Cost is probably the number one in most families' minds. I think the quality of care also is important, and access, of course, is also critical. But I think one of the other things that I see that I think that's important here is that I think we need to educate our families, okay, on what quality childcare is all about. One of the things that we did at Hildebrandt Learning Centers, we produced a sheet that we gave to families and said, these are the things that you should be looking at from a quality aspect here at our centers, and take this to other centers and evaluate those centers. And I think if parents become more cognizant of exactly what a quality program is, I think that might up some of the games of some of the other childcare centers, because they need to understand that they're not going to get the enrollment if they're not producing a quality program. So I'd say those are the things that I think that are probably the barriers for families at this point.
Can you just say another word about quality? What you think that looks like?
Well, I think the Keystone Stars program, and we always felt that the seal of quality was, and Jen, I'm going to point to NEPA, was NEPA accreditation. It was rigorous, it was tough. We had 35 centers accredited, and I always felt that was important. And that to me, and for me, it always, from a standpoint of quality, we always, and the education of staff, the continuing education of our staff was critical also. It's not just, okay, they have the degree in early childhood, let's put them in that situation. We always required at Hildebrandt that our staff had to get 40 hours of training. And we felt that was critical. We set up our own system of, we call them napinars, where during nap time, we did pre-recorded education and so forth. So our staff could, learn about the newest and best things that are happening in early childhood. So, that's critical. I think getting our staff also, keeping them educated on what's going on in the industry.
I'm stealing that word, napidars.
Napinar.
Yeah, that's terrific. Jen, why do you think some centers struggled with the accreditation? Those who weren't able to get it, was it will, skill, resources?
I think it's all of those things. It does come at a cost, so it's not free to be accredited. But at the same time, as Bill said, those standards are rigorous. It's also rigorous to become a Keystone Star 4 rated program in Pennsylvania, which we consider equivalent to the NEPA accreditation. So that means, all of these things are based on research-based standards. So as Bill noted, your staff is the key to that. Having a curriculum in place that aligns with the state's early learning standards. There's business practice standards. So it's a variety of things programs need to meet, and some of them do have a cost to be able to get there. There is a pretty big conversation going on in Pennsylvania about like the Star 1 and 2 programs who really do want to move up, but they recognize they need the resource to do that.
Andrea, you mentioned a couple of times, the business modeling of childcare and the business perspective of it. It's a really interesting business tightrope, I think, that childcare centers are walking. You need the staffing, and you need to be able to invest in staff. You need the numbers to be able to support this. I'm sure you've seen that as a fine line, I would say, between those who are successful and those that don't quite make it there. So you also started, you said a word and mentioned Bill as being on the forefront of this. I mean, right now it's an employee market out there. Businesses, all kinds of businesses are struggling to recruit and retain employees. We know that childcare can be a good employee retention tool. Bill, could you talk a little bit about that? How employers can better support their staff by addressing childcare barriers and for people returning to work or remaining in the workforce?
Well, number one, I think most employers see all these roadblocks with providing employer-related childcare. Some of the things that I've run into that I've seen over the years is, and I'll just mention a couple of these before I talk about how I think employers can get over the hump and over these roadblocks. Number one was cost, of course. They are always worried about the cost of providing any type of care. Liability was big. Many of the employers that I sat down with couldn't get past the liability issue. And I think once we got them past that, then they felt pretty good about moving forward. You had licensing and certification requirements. They were always concerned about that. And then there was the equity issue. The equity issue from the standpoint, I'm providing a benefit for my employees that have young children, but then I have other employees that don't have young children who maybe have elderly parents or no one to care for. Where's my benefit? So we ran into those equity issues also. That was also a roadblock for a lot of these employers. some of the employers we would talk to said, hey, this isn't my issue. That's a family issue. This isn't something that we should bring to the employer to try to resolve. And I've always explained to them, I said, this is good for business. Recruitment, retention, productivity, community image, and so forth was so critical. And I think it's that education process to some of those employers to get them over that hump. Quality also was an issue. How do they evaluate quality if they don't want to provide, as Andrea said, the gold standard of having your own center, but maybe somehow subsidizing another center? How do they know what quality is? That's important. And sometimes even smaller, even companies that then have a large employee base say, well, I'm not big enough to do some of these kinds of things. So those were some of the barriers and the roadblocks that many employers talked about when I was talking to them about expanding into the childcare. Now, how to get over that, we gave them a number of options that they could look at. And there's some low-hanging options that they could look at, such as the child independent tax credit. Explain that to them. That child care and referral program. Do something like that for your employees. Dependent care, their FSA accounts, establish something like that so they could put dollars away for their child care. We also tried to get employers to think about prioritizing enrollment agreements with childcare centers in their area. If you don't want to do it yourself, look for some good quality childcare. And that's part of the education process I think we have to do with employers, but you could set up a priority agreements with some of the childcare. Now that's the low-hanging fruit. That's pretty easy to do, that we can get companies to do. But then of course there's the I call it the all-in option, okay, where they're really getting involved with the childcare with their employees. And you start off with childcare vouchers. We're going to give X amount of dollars to help you, assist you with going to a high-quality center. Sometimes that's an issue because sometimes employees don't pick the best of the center, so that's sometimes an agreement. An issue. Rate agreements with other childcare providers, setting up directly with those childcare centers a rate agreement that's a discount for their employees, so we could push those to those centers. And then, of course, as Andrea said, the ultimate is the employer-related on-site childcare center. And one of the things I think that employers don't understand, well, first of all, some of them don't realize there's a federal tax credit for providing childcare, and many times when I talk to employers, they went, "Oh, I didn't realize that was available." Believe it or not, I had 45 childcare centers, and Andrea knows because she actually worked for me at one time. Centers can make money for an employer, not significant money, but they don't have to be a losing proposition. They could do it. And I think why we were successful, or why maybe I was successful in my business, my background, I'm an accounting major and an MBA. So I know numbers, okay? And I know how to, if you ask me what the cost of a child meal is, I know right to the penny. So when we sat with employers and try to explain to them that this doesn't have to be a losing proposition, then they sit up and they listen a little bit, and then they go to the next step and say, okay, let's do that needs assessment. Let's see if I really do have that need in my employee. And then the next step to start developing budgets and so forth. And then everything else, Andrea, as you know, going along, finding space or building a center and so forth. So I think part of this is getting employers in Pennsylvania the knowledge that doesn't have to be an all-in, but even if it is all-in, it doesn't necessarily have to be a losing proposition for them.
So we want affordable quality childcare center readily available in our communities. Is there anything about those two words together, accessing affordable, if using that word, does that in any way mean to somebody that it's not high quality? I don't know who I'm asking this to, I guess anyone.
Well, I'll jump in real quick since everybody is still muted. Talking about affordability for the family, of course, that's what we're trying to get at. But again, to be high quality, again, we were talking about wages, a living wage, benefits, and so forth. And I think there's only about 14% of all the childcare centers in Pennsylvania offer some type of a benefit. Healthcare. We offered, when we were there, healthcare, vision, dental, 401k, so vacation, and all of that. That like a real employer, and that comes at a cost. And when I would talk to a CEO, I would explain that to them. And I have walked away from employers who wanted to do it on the skinny, okay, where they basically said, well, I really don't want to spend that much money on it. And I would back off and say, well, I'm sorry, our programs can't do that because we're hiring people at a better wage with benefits and so forth. So affordability maybe to the families, but to provide high quality, the dollars have to be there, whether they're coming from the families, the employer, or through the government. We need the dollars to be able to provide high quality. That's the bottom line.
I think you make really, please.
I was just going to add on to that for us as advocates, we don't separate quality and affordability. For us, especially when we're talking about government dollars, when we're providing a childcare subsidy, one day we would like all of those subsidies to go to high quality slots. That is the best way to spend taxpayer funds because we know, as Andrea said, that's where the return on investment is. So one day, hopefully in Pennsylvania, all children will be able to go to a high quality Star 4 or accredited center or family childcare, program. But until then, our advocacy focuses on both. We need to make sure it's affordable, but also have high quality options for families.
And I would just also say that when, businesses are thinking about investing, and Bill laid it out so well, I mean, quality comes at a cost and you can't do it on the skinny, but what is the cost if you don't invest? And so, and again, we're kind of coming back to like this economic picture, and we know that the turnover rate when families can't access quality childcare, I mean, it costs 20% on average of an employee salary to replace them. And we have, statewide studies that show, it's a big problem, and it's causing something called presenteeism. So you have parents who come to work and they're worried about their children because they don't have reliable, quality, accessible childcare. So they're not fully present, performing their best at work. We have high rates of absenteeism, turnover, and it all comes at an economic cost. And, Lisa, I think I might be jumping a question, but, we know that figure in pre-pandemic was $3.5 billion, 3.47, close to $3.5 billion of an economic impact that Pennsylvania suffers because of a lack of affordable, quality, accessible childcare, and absenteeism, turnover, lost tax revenue. So I think when we talk about, when you mentioned this in the beginning, this like kind of bigger picture of childcare, this is also something that resonates with the business community, that knowing that, not only is it something that affects our bottom line, but it's, it's much bigger than that as well.
So you're saying, I mean, this is why it's important to everybody, not just maybe a family who has childcare needs, but really everyone is affected. Is that?
Yeah, I would say that. Yes, everybody.
It's interesting. When we did needs assessment surveys at companies that we would send out, and one of the questions that I always asked, and I thought that was interesting, was if you do not have children, do you see a benefit of childcare at your company? And I gave a couple of reasons, that your coworkers would not be absent and be more productive and so forth. And it was interesting. And I think the number was probably about 90% of the people who didn't have kids felt that it was critical to have their coworkers have childcare because it made their life a little bit easier, that they didn't have to pick up the ball, and because people were always concerned with their childcare or being absent or the turnover issue. Somebody new every other week because of a childcare issue. So I think you'll see that employers need to understand that it doesn't just good quality childcare, if they provide it, doesn't just benefit the families that have young children, but it benefits the entire workforce.
And I think you make an interesting point, Bill. You know, for employers who are really looking to do it right, it's not just about, you know, offering this or, you know, having it as an option, but really working it into our benefits package. When we're having these conversations with potential employees, this is a benefit, you know, almost as important as healthcare or vacation days.
Yeah,
that's how it should be viewed. So what can be done in areas that may have job opportunities, but no childcare opportunities in those immediate areas? Marnie, can I ask you to start with that one?
Sure. I mean, I think Bill addressed some of the strategies. If an employer can partner with a child care in another community, maybe who is operating in another community, to consider offering some sort of care in their community or around their community, and provide some sort of supports to help get that going. Also, you know, possibly doing the vouchers or the some sort of a rate agreement with providers who are in the communities that their employees live. The chances are their employees don't all live in that one community where the employer exists. So where are they living, and can you make arrangements with some of the employers out in the communities that they live in?
Right.
Lisa, I would also say too, I think in some of our more rural communities where we may not have, you know, official childcare centers, there is an opportunity for home-based childcare providers to kind of fill some of those needs, especially when we think about some of the non-traditional hours and days that employees may work. And there are a lot of home-based providers that are also quality providers. And so it is just something we don't necessarily want to overlook. You know, certainly we love the, you know, the full, you know, 150 child center or bigger, but in a lot of communities where they may not have that, there may be, you know, home-based childcare providers.
One area in Lancaster County that was, I guess, more rural than others. One school, what we did is there was a big need for childcare. What we did is we went to the school district and we talked to them about the possibility of opening up, you know, can you give us one classroom that we could provide childcare for this area that was in the Gap area. That's where it was in Lancaster. And the school district opened up the one classroom and we were able to fill that with 20 children. And then the next year it expanded into the second classroom and into the third classroom. But that was one way. I think you got to sometimes think outside the box. It doesn't necessarily have to be a childcare center. Where else can you provide this quality childcare center? And the school districts might be one of those options to do that.
I will have to add, we shouldn't forget about Head Start, which is very good at serving rural communities. And we don't consider them childcare in the sense that they're not funded in the same way, but they are federally funded, and they do have, you know, certain requirements in terms of income and eligibility. But that is a really great option for accessibility purposes.
Jen, would you echo what Andrea was saying earlier about home-based childcare centers and the quality?
Absolutely. And we need to do more to support more of these, mostly women who are providing this service in their homes to help them reach those higher quality levels. But it is a really smart solution in more of our rural communities where there's just not the population base to support some larger programs.
And Bill, that's where you're coming from, right? You know, it's not just a brick and mortar solution to everything. We need to get creative with this. The idea is to provide childcare, and that could look very different.
Mm-hmm.
All right, so 2021 question, how has the pandemic affected childcare centers and options for families? Andrea, would you start with that?
Sure. So it hasn't been great. You know, I know that we had, you know, a significant number of childcare centers that at the height of the pandemic were closed. And unfortunately, we do have a pretty big number that are still closed and may be permanently closed. The costs to the childcare providers were significant, increased costs and lower enrollment when they did open up. I know that's still a huge problem. The loss of staff too, staffing, is at a crisis level. The cost of increased costs of health and safety, like your protective equipment and cleaning materials and the staff time using to do that. So, it really has posed some significant challenges to the field. We've been fortunate. There have been federal dollars coming in, state dollars coming in. We have an opportunity for more federal dollars that will be coming in soon, and hopefully we'll have some guidelines on how they'll be spent. But again, I think from the business perspective, the challenges also made the conversation around the importance of childcare almost a daily piece of our conversation.
Yeah, I'll piggyback on that. We just got new data yesterday. Net loss since the pandemic started is about 200 programs that have closed their doors permanently. I'm still waiting to get a number of where we are on temporarily closed programs. These are programs that closed like back in March and April and said, oh, we'll reopen at some point. Last we saw that was still over 300 programs. So when you think about the capacity that was lost in the childcare system just in 1 year, scary to think about what families had to do when they lost their provider. We've heard anecdotally a lot of parents did rely on family childcare. This time they were a little more likely to stay open. As Andrea said, until the American Rescue Plan passed, while we have received federal support, it has not been enough to make up for the added costs for PPE and cleaning supplies and then the lower enrollment. I would say just in the last few weeks, we've been hearing more and more stories from providers we've talked with at our organization who, because kids are spreading the COVID-19 more rapidly now, they're experiencing issues within their own staffing, having to close down more. A lot of the directors I've talked to are actually filling in the classroom now for their teachers. So this is not over. And we've already seen a pretty big impact. Andrea, I think though it's nice you mentioned the silver lining, which is I am doing so many more of these types of conversations where we're talking about solutions. And I think the fact that childcare is being put on the map, so to speak, at the national level by the president, by members of Congress on both sides of the aisle, this is a bipartisan issue at the national level. So that is one positive out of all of this. Good point.
I'm concerned because about what's going to happen as we come out of this pandemic. From the standpoint of the way we work is going to be different, and I think we have to realize that. I'll give you one example. There was a childcare center that I was working with, and they opened back up and so forth, and they started to call their families back and say, we're going to be open and so forth. And they had the concerns about spreading the COVID, but probably, and I'll use this number, probably about 20% of the families said, we don't think we're coming back because my employer is going to allow me to work from home. So I'm going to keep my child at home with me because I could still get my work done over that period of time, whatever. I don't know how they could do that with a 3 or 4 year old running around, but they're looking at it that they're saving the money, okay, from the standpoint of childcare. And also they probably have some health concerns. So this center was concerned because they're probably going to lose about 20% of their enrollment. So I think what we have to do also is we have to start to educate parents again that how important early childhood and the socialization and so forth, how important that is for their child, that, sitting in front of the TV watching, Sesame Street is great for a little while, but it's not going to help them in the long run. They really need to be in a high quality situation where a credit or a 4-star or 3-star center where they're getting those positives to get them ready for school. So I am concerned with that, and it's going to be interesting to see how this next year is going to work out. How many businesses are actually going to come back and open up their offices again?
Yeah, Lisa, I want to come back to one other implication, which is the mental health and wellness of the staff. They've literally been working in a war zone for over a year now, worried about their own health, their family's health, the children and families that they serve. And then we also have the mental health of the children who are returning now, who've been home for over a year possibly. And we're looking at behavioral concerns for children, having to adjust to group settings again, adjusting. It's a difference, it's a change. And so we are, and on top of that, the staff that are supporting the childcare staff, there are over 250 staff who are employed or partnered with Office of Child Development and Early Learning who go out every day and support the childcare providers, and they don't know how to support them with their mental health and well-being because they're hearing the stories, they're hearing the strain and the stress, and they weren't equipped. And so the Office of Child Development has been pushing out initiatives to support all levels around that, but it's a big lift, of course.
My team at United Neighborhood Centers who work in our childcare centers and were able to join today are standing up and cheering now, and they're also waiting for more. This is so critical. These things that we're talking about, the enrollment, the reduced enrollments. I think some centers like ours that remained open but saw the huge drop in enrollments are wondering what happens next and how long can we sustain this, waiting for things to go back to normal or, waiting for the workforce to sort itself out. And then Marnie, everything you just said, the behaviors like we've never seen before, young kids that have just not, been really socializing in meaningful ways in a year. It's coming out. It's aggression and it's concern. And a lot of us are just scratching our heads. These are issues we've never had to deal with. And what about those centers, Jen, that you talked about that are on the maybe list now, that they're hoping to reopen, but what if the numbers aren't there? Where's my question in all this? I don't know. I guess I'm waiting for who has the crystal ball to figure out what comes next, but that's why we're here. That's why we're here. Can we just, I feel remiss if we didn't link the cycle of poverty to all of this before we get wrapped up. Can we talk about the impact of childcare and how this could be an opportunity, how quality early childhood education provides opportunities for children to break the cycle of poverty?
Sure. There's a lot of research that, shows all the benefits for all children in high quality early education, but most of all for children in poverty. That's why childcare subsidies are so important. They do help level the playing field and give low income families access to high quality programs they otherwise wouldn't. But I have to say, as Marnie noted earlier, in normal times, there's typically a waiting list for that program. There's a lot of families who might not know about the program. I think you mentioned that as well. That's something we've been trying to take on, is to encourage the state to advertise it better, along with our quality program Keystone Stars. There are a lot of parents not accessing it. Just to give you some statistics, when we look at all of the eligible families in Pennsylvania, it's only like 81% it's 81% that are not able to access high quality childcare subsidies for kids under 5. You look at your counties, Lackawanna, it's 82%, Luzerne, 85%. So those are numbers from October 2020, probably impacted by the pandemic, but I'll tell you, the year before's numbers weren't much better. So I think there's a lot we can do to make sure parents understand and know this program exists, because that's the program that's critical to making sure all children have access. And then for the programs that participate in subsidy, as we've been talking about, it's not just about the family's affordability, making sure we support the programs, pay them based on what it actually costs to provide the care. I think, as Bill was trying to say earlier, so they're paying their staff appropriately to maintain those high quality programs and build more of them.
And childcare is a 2-generation workforce issue, right? We said earlier, we have the longitudinal studies that show when children, particularly, those children who are most at risk, have opportunities for high quality early care and learning, you're being set up for success, right? And they are going to be the workforce of tomorrow. And when families have, their children have access to high quality early care and learning, quality childcare, they're able to go to work, be productive, and be successful and take additional opportunities for advancement, additional training opportunities, education opportunities, and advance their career. When I was kind of working more in Lancaster County, I was on the Coalition to Combat Poverty, and it was called One Good Job, because truly, like, if there's a good job and families are earning, good income and can afford quality childcare, and, it just makes that cycle, it really is a positive influence. And, quality childcare is just a key piece.
So, I mean, it sounds like we're talking about community-wide strategy on education. Bill mentioned it earlier around the idea of getting the enrollments up, getting kids out of, the home-based care, not home-based care, but staying at home with a parent who's trying to do both, work remotely and provide quality care. There's a better alternative. And there's also some really positive reasons for a person. Arguably, it would give a child a leg up getting into a quality childcare center. Laura, I know your burning question is around, so what next, and what's the role here for women in philanthropy? What can we do to support these needs?
Absolutely. I think that's key. I mean, we've learned so much tonight, and I think, what we're hearing from a foundation perspective is this issue you mentioned, it was mentioned so often tonight that it truly is on the forefront now. It's key in all economic development conversations, economic resilience conversations. But, tonight we're exploring it from a women in philanthropy investment areas. How can we look at this in a way that we can make meaningful investments from a collective philanthropy model in a way that benefits low, moderate income women and families. So, the perspective of our experts tonight, what do you think is necessary that you're not seeing happen, or that needs to happen better? And that's really the burning question.
I do think, Lisa, to your point, a good role for a foundation could be the education aspect. So, people are more willing to listen to people in their community, right? So if, you guys were to take some sort of role partnering with your early learning resource center to get the word out about how to choose a quality childcare program, what Keystone Stars is and really means, what the subsidy program looks like and how it works and who's eligible. I think those things could go a long way locally. And it would be an interesting test case to see, like, would it drive more families to apply for childcare subsidies in Lackawanna County, for instance, for the state to see? Because like I said, we've been trying to push on this at the statewide level to spend some money on marketing. I have some background experience in the children's health insurance program from time at the state. And anytime we advertised on TV or the radio, that's when we would get a big influx of families. So I really believe wholeheartedly it could be the same for our subsidy program. So I think that could be an important role you could play.
The other thing this is kind of out there, so feel free to dismiss it, but one of the things that we know is that sometimes, especially women in poverty, can be, if they're supported, might be able to begin their own family childcare. It's possible to, put a person through certain steps in education. I mean, they don't have to get a degree, but they could learn how to operate their own family childcare if they had somebody investing in them and supporting them and guiding them. It is a small business, but it's doable. And we thought about supporting that with some federal grants in the past for TANF clients who are receiving subsidy to help walk them through the process. So it would definitely be an undertaking, but it is, I think, an incredible endeavor because family childcare, I believe, is one of the next best things coming, considering where we're headed, you know, in terms of possible funding, but also the hours that people are looking for. So it's one of those out of the box ideas.
Both examples so far have been terrific. The education piece playing a role, and you know what you just mentioned too, tying that in with the entrepreneurship component that WIP fosters. It's definitely a wonderful possible solution for us. So we appreciate those. And if there are more, Lisa.
One of the issues,
Yeah.
Sorry.
Lisa, just real quick. One of the issues that I always kept bumping into when we were operating centers is I never understood why a community with a number of childcare centers couldn't get together and let's call it get together and organize, if you want to call it that way, to be able to share ideas, to share staff even. I mean, there was always, I think the number is 92% of all childcare is in mom and pop situations. So, you know, we always tried to share when we were doing NEPA and people were thinking about going for accreditation and it wasn't our center. You know, I had people that worked for us that we sent and we allowed them to help them work on that, because I think, you know, and I always said this to other centers, you know, bringing up the quality in a community throughout the community is going to help everybody, because everybody's going to look at this and say, we have good quality centers. We're going to get more kids because of the quality. And I just never understood why we couldn't do that. And I don't know if anybody could ever really pull groups, and it really has to be the communities. You know, you have to bring, you know, the Wilkes-Barre, the Scranton areas and so forth, the Lancaster, bring those groups together. You know, you have to get them together for meetings, but they never really work together, at least in my experience. And maybe that's changed in the 4 or 5 years that I've been, you know, out of the business, but I would like to see something like that. And I think that might be a big plus, especially from the fact that I think coming out of this pandemic, you know, people aren't going to be running at 85 or 90% occupancy levels. They're going to be a lot lower. So, you know, how do we work together to be able to increase those enrollments? Or maybe we join together and, you know, eliminate a center and create partnerships and start to think in other ways. Just a thought.
I think it's a good one. And I think that's too easy not to happen, too easy not to work. You know, talking about a coalition or a provider support network. I think that would be welcome by providers. And Marnie, I don't know if your idea was crazy or just crazy enough to work. I think that falls into the category of two birds with one stone. You know, we're talking about workforce development as such an urgent need now, and childcare. And if we can somehow tackle the two at once, that's probably a good use of time and resources. What do you think, Laura?
Totally agree. I thought it was just in line with the kind of things that we're looking to do. So, well said.
And I think I would also say, I think there is a great opportunity for the foundation and the Women in Philanthropy to really kind of understand what the landscape is in your community, especially when it comes to businesses. And, you know, Marnie mentioned that, you know, a very simple tool that businesses can use is a survey to understand what the needs of their employees are when it comes to childcare. And then, you know, educating businesses on this variety of options that they can provide to their employees. And like you said, it can be from the importance of information and referral, like we talked about, the education about how important quality is, how do you access quality, you know, the long-term benefits of quality, and, you know, and it can be tax credits too. Like, do businesses offer the flexible spending account? I think we think of that as like a low-hanging fruit, but it's a cost savings to families, and it can be a significant cost savings to families. And then all the way up to, you know, contracting slots, or, you know, partnering with local providers, or opening an on-site, or having several businesses come together and open a childcare, you know, provide center. So I think, you know, really helping businesses in your community understand, like kind of figuring out how they can figure out what their need is, but also then what they can do to respond to that need.
Perhaps effective partnerships with the chambers of commerce and kind of pulling these conversations together, understanding more, you know, making sure we're asking the right questions from experts like yourself, and that could be a good way to start.
Andrew, I think it's a great idea to do surveys, but we used to run into an issue with employers when we talked about doing a survey for childcare. First thing they said is, oh my gosh, if I do this, then my employees are going to expect that I'm going to do childcare, or they're going to continue to knock on my door or my HR's door and saying, where's our childcare center? So, you know, we got to get them over that hump also. And that's why I always used to tell them, you know, do it. You don't say you're doing it. Say that, you know, Hildebrandt Learning Centers or the United Way or somebody else is just doing general information. But that was a roadblock. That really was, sometimes, to get the information.
I have heard that. Yes, yes. I conveniently forgot that though, but I'm glad you brought it up.
Reminded you.
But maybe it's time, you know, to keep talking like that again, or to start talking like that. Things have changed so much, you know. Do we ever think that we'd be having conversations, you know, about sending staff home with computers and you know, doing so much remote work? I think employers are really viewing things in a different way and managing costs in a different way. And I think that employers too, you know, this past year, you know, we really knew how valuable our teams are. And I think employers want to do everything they can to support their teams. You know, making it through something like this, I think, puts things in a different kind of perspective for us. And I love that there's a lot of solutions here that we're talking about, that, you know, some of them are a stretch. Others, I think, are easier to get to, but there is a road. There's a road through this. Would you agree, Laura?
Real tangible, implementable solutions that I feel like we'd be able to start to tackle along with partners.
Agree. I don't know that we have any questions from the group. So if not, I would just ask our panelists if they have any final words for us.
There is a question that's out there. I'll read it out.
Oh, I'm sorry.
No problem. One so far that I see, but the question is, what is a solution to this issue? The question is, they've seen when interacting with child care center directors that they may not often be as skilled in managing staff in a child care center. They might have the background in early care and education, but not in management. And so if the center is not managed well, are the quality investments maximized? So I think it's that dichotomy of skills. And the question is to the panel on that, if you want to elaborate a little bit on that.
Yeah, I saw that. Actually, I thought that was a great question because it's timely. The Office of Child Development and Early Learning recognizes that, as does the Office of Child Care from the federal level. And they actually, at the federal level, developed a TA system. They have a TA system that developed a training to really train providers on the business side of early childhood education. They piloted that in Philadelphia, and it was successful. The providers got a lot out of it. And so Octel is looking to replicate that with some of the funding that's coming through because of COVID, and do it statewide. And that's where we come in, because we often manage train the trainers for the state. And that's what we'll do, is we'll offer it up to trainers across the state to attend these trainings. It's a series of trainings that the TA center will offer for a fee, which we'll cover, and we'll even pay the trainers stipends to go out and disperse that information to providers, as many as they can get across the state. And we usually give them a year to try and get so many trainings in and reach as many providers as possible. But it's definitely something we recognize and are working on.
I think part of the problem are teachers that are coming out or potential directors from colleges and universities really have not received the training, any type of business training. And King's College, I taught a course for about 3 years there. Then eventually they decided that to drop it because it wasn't getting, maybe it was me, they weren't getting the enrollment in that course, but it was called, Childcare Administration. And what I did is, for those 15 weeks, we went through budgeting, HR issues, how to handle, how to hire, to fire, all of those kinds of things of like running a small business. And, we did that for 3 years and we thought it was, successful. And some of the people actually that were in the class, I eventually hired, and they had a little bit of a background in that. But, and I think we forget that a lot of these people that are going to be coming out, they're not just going to be, classroom teachers. Many are, have aspirations of being a center director or owning a center. So I think that was an important course. And I think that we need to train those individuals a little bit better.
Good point. Jen, when Laura was reading that question, you had the knowing smile of somebody who's seen this before. I just want to say,
yeah, and I knew Marnie would cover it because I was aware of that program. But I will add 2 quick things. To Bill's point earlier about trying to bring together people locally. The other thing that I've heard is helpful is where there's directors roundtables that exist. It allows some of the newer, more green directors to learn from those that might have a higher level of training, like he's talking about. So kind of building off of each other's experiences. I've heard that works. The other thing I'll just pitch, we offer a resource online. It's called sharedsourcepa.org, and it's free. Anybody can sign up. It offers kind of like that, in some ways, back end services. So management type resources. So like if you're looking for a form for something, you don't have to reinvent the wheel. Also offers up information about like the STAR system and how to meet quality standards. But there are some basic resources there, like I said, for free to anybody who just wants to log on and get an account.
So there's resources that exist and also opportunities. And almost if we, played off of some of the ideas Bill mentioned earlier around a coalition or a support network, we can even build in some mentoring opportunities or support for new managers.
Absolutely. And that was going to be, my next question is just, it was addressed already, started to being addressed, but it's local supports, local resources, things that, we should be aware of as a connector of things that we can continue into the next steps and conversations. So I appreciate, Jen starting to provide that to us. And I'm not sure if there's other things we should be aware of from the state level, et cetera, in that. Or if there's any other questions. I think that was the main question from participants, but I know we're going to have a lot that come up afterwards.
Any final words from the panel?
Just thank you so much for, having us here. This is a super important conversation, and I'm really excited that Women in Philanthropy is looking at so many different angles of this complex issue. And please, I know that I'm not speaking for everybody, but I know that we all are a resource, that you can call upon. And I know that we have some commissioners in the early learning investment commissioners in your kind of neck of the woods that would certainly be very willing to talk to other business leaders about the importance of investing in quality childcare.
That's great. Thank you very much.
I'll just add with my advocacy hat on, the other thing we're always asking people to do is to educate your lawmakers. After this is over, I'll send you the fact sheets I was kind of taking the data from, where I was talking about Lackawanna and Luzerne counties. That's what we try to do. We try to make sure they understand like what the state of childcare and pre-K are in their own district and their counties. So if you need any resources from us, we'd be more than happy to help. Local providers share their stories with legislators so they understand what they're going through. And we've also seen in some other areas the state county government step up during the pandemic. There's kind of discretionary dollars they got for some of the pandemic relief, and particularly in the Southeast as well as Allegheny County, county Commissioners chose to prioritize childcare. So just another thing to think about with your local elected officials. And just thank you so much for letting me be part of the conversation today.
Thank you. And we would appreciate that if you can send us the fact sheet and any leave behinds. It sounds like we have to get some meetings on the books with our local lawmakers.
Absolutely. And as bridge builders and connectors and philanthropic investors, everything that was discussed tonight, there's so many really tangible opportunities and solutions. We truly appreciate your insight, your time. Lisa, terrific. We appreciate your work moderating this excellent panel. I think we learned a lot this evening.
Thank you. Thank you to all of you. It was great being here.
And last words quickly is just 2 weeks from now is our final panel in the Breaking Barriers series, webinar series, and that's on affordable and accessible housing, same time 2 weeks from tonight. So thank you so much for all of you and sharing your knowledge as we explore this critical issue and how we can make an impact.
Thank you.
Thank you.